Catherine Chiwaula, principal nursing officer. Yeah, and my work basically is to oversee implementation of the school health and nutrition program.
What is exciting about the school health program?
Yeah, the school health program, usually what we basically do is to provide health interventions at the school. Yeah, and some of the interventions which we do are health assessments, yeah, deworming, and also with the malaria screening and the treatment of minor ailments at school.
You have been one of the MOH staff who have gone through the evidence-informed policy-making training for the past year. And we're just keen to hear from you. What difference has this training made to your work?
Yeah, the training has been useful to me because one of my work is to oversee policy implementation in the ministry, especially in the area of school health and nutrition program. And after the training, I acquired knowledge and the skills on accessing, appraising evidence, as well as applying evidence. And that knowledge and the skills has helped me to improve on the formulation of school health and nutrition policy, because I attended the training at the time when we were also in the process of formulating the school health and nutrition policy. So that knowledge helped me very much as we were going through the process of formulating the school health and nutrition policy.
So you feel that that policy was enriched thanks to the training program?
Yeah, that policy was enriched because after the time we were doing the training, that was the time when we were in the process of gathering the information about the policy or looking at the evidence which is there as regards to the school health policies. So after the training, that made my work very easier because I could go and access the evidence relating to the school health interventions, school health policies, the studies that have been conducted relating to the school health and nutrition policy. So that also helped me to participate very well in the process of formulating that policy.
So that's a very good concrete example in terms of how you have been applying the evidence. Do you have any other example in addition to the school health program where you have worked on a task differently because you have gone through this training?
And yeah, the other example which I could give is about the reports, because daily we are producing reports in the Ministry of Health. So that has been easier for me to access the information relating to the writing of my reports in the directorate. Yeah, because I used the same skills in order to produce the reports.
The reports that you work on. When you think about using evidence in your work, and we know that you are very busy doing other things, particularly the program you're running, so in terms of creating time to, because using evidence is a process, isn't it? And you have to have the time to find the evidence, go through it, appraise it. So what really motivates you to go out of your way to use evidence in your work? Maybe just one there could be many motivators, but maybe one thing that motivates you to use evidence.
According to my work, I think it's inevitable to, you have to find the evidence, because for example, if you are producing a policy, you have to look at other documents. So that has been the motivation, because you cannot produce a policy without looking at other documents or without looking at the evidence. So that has been the motivation. Or when you're producing a report, at least you need also to beef up your report. So that has been the motivation.
Okay, thank you so much for agreeing to talk with us, and we hope we'll continue interacting with you as we continue this work.
Thank you.
Okay.